For more than a month, Global News has been working to find answers to your questions about COVID-19. And one that keeps coming up is what it's like to actually have the virus. Our Jeff Semple has been speaking directly to Canadian patients to find out. Jeff.
Well, Donna, for the past few weeks, we've been taking viewer questions straight to the experts. But this time round, we're asking a group with first-hand knowledge of what COVID-19 can do.
I'm feeling like a bird that's been out of the nest.
Karen Shoemaker has never felt so excited to be in her kitchen.
There's my steel-cut oatmeal that I'm cooking for myself for breakfast for the first time in a long time.
She's just completed 3 weeks of quarantine, one of the first people in BC to be diagnosed.
I was in that right age group to be really dangerous.
One viewer named Wayne wrote in to ask, do the symptoms of COVID-19 include a loss of taste or smell? Shoemaker says that was actually one of her first symptoms.
I couldn't taste coffee, so I would say, don't bother making a pot. I can't taste it.
Deb wrote in to say, I understand most people are only experiencing mild symptoms. Can you please elaborate on what mild means? Kyla Lee's COVID-19 is considered mild, but it sure doesn't feel that way.
To be plagued with a fever for 2 weeks, a cough for over 2 weeks, shortness of breath at even the most basic activities, that's not fun. And for that to go on for a long period of time when you're completely alone is scary.
Kirsten wrote in to ask, should younger people with underlying health conditions such as asthma be self-isolating and not going into work? Emilio Merritt thinks so. He suffers from asthma, and COVID-19 landed him in hospital.
The way that you can breathe is totally different, because the asthma, when I get the asthma, is more like a wheezing, like that's more like when the asthma thing, and this one is more like you cannot get air inside.
And Terry wrote in to ask, could you please provide a real description of the devastating symptoms individuals are suffering? Erin Lee is just 38. She's been in hospital for a week.
Really, that's the big thing, is just not being able to catch my breath.
Lee has an underlying medical condition, but no recent travel history.
So as far as we know, it's community transmission.
Lee and all of the patients we spoke with also have a message for the viewers. They say, please keep your distance, and if you can, stay home. Donna?
Can't say that often enough. Jeff Semple in Toronto, thanks. Jeff will continue to consult with experts and try to answer your questions. Send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.